Well, today, global health leaders, policymakers, and local doctors are coming together in Chicago to address some of the world's biggest humanitarian disasters. Think globally, act locally is the theme of the conference, which is put together by Med Global, which is a Chicago-based medical organization. And joining me now is Dr. Zaher Sahloul, who is Med Global's conference and gala director. Actually, Dr. Sahloul, what is your title?
I'm the co-founder and president of Med Global, but also I'm a local physician. I'm a pulmonary and critical care specialist at a couple of hospitals in Chicago.
That is what I thought, and I know we've spoken before. Sorry about that. I just want to make sure I got your title correct. He's live, of course, with us from the conference right now, and thank you for taking the time to chat with me. Now, the agenda is packed, I know, with doctors from the front lines, including volunteers who recently returned from Gaza, but also doctors from areas that do not get as much attention, such as Sudan. Can you give us an overview of what will be discussed today and why it's so important?
Good morning, and thank you for having me, Donna. So this is really a different kind of conference. In Chicago, always hold conferences. I just finished my chest conference a couple of days ago. But this is a unique conference where we have volunteers, doctors from Chicago and other parts of the United States who've been in war zones in Ukraine, in Syria, in Gaza, in Sudan, and came back with their stories. We have artists who want to describe what's happening in these areas through art lens. We have tech leaders who will talk about using technology and AI and how that will be impacting global health. And also the theme of the conference is the world that we're living in 2025, where there's a lot of displacement, a lot of refugees, many wars, climate change affecting us, pandemics. We just finished an overwhelming kind of COVID-19 pandemic a couple of years ago that affected many lives. So all of this is happening, affecting our healthcare. The mission of Med Global is to improve access to healthcare in disaster areas. We have people in Chicago who are suffering, who don't have access to healthcare. We have people in the rest of the world, in Gaza, in Sudan, in Ukraine, who don't have access to healthcare also. We are dealing with limited resources. So how can we deal with this turbulent world and improve access to healthcare in Chicago, in the United States, and also at the global level?
That's what you were just saying then. That kind of speaks to the theme, think globally, act locally, doesn't it?
It is. As responsible citizens, we believe that it's our responsibility, first of all, to pay attention to what's happening in the world, improve the suffering, not only by talking about it on social media, but also by acting. And when you are a doctor or nurse and you have a busy schedule and you go to places like Gaza or Ukraine or Sudan and risk your life to stand with the local communities and then come back with these stories, I think this is very important. And this is the essence of humanity. Chicago is a city of big shoulders, but also it's a city of big hearts. We have many doctors and humanitarians from Chicago who risk their lives, and they're coming back with these stories. So it's very important to listen to their stories. They make these complex crises more simple, and they touch the heart by talking about what they have witnessed in disaster and war zones.
It's so important. Dr. Zaher Sahloul, thank you so much for joining me this morning. As always, it's a pleasure to speak with you, and we'll be right back.